Happy Nurses Week. I'm Crystal Murillo, Director of Clinical Simulation and Assistant Professor here in the College of Nursing at the University of South Carolina. So it is my pleasure to come to you during the week of the month that our nation has chosen to celebrate and recognize the amazing things that you are doing as nurses. I'm thrilled to talk to you about self-care. So I have a question that I'd like for you to answer. The question is, do you self-care? If you answered no, then I am so excited for you to hear what I will say in the next few minutes. And even if you answered yes, I'm excited for you to hear what I will say in the next few minutes, because maybe you identify a way that you can grow your self-care practice. Interestingly, so I'm just jumping right into the talk about self-care. Interestingly, as nurses, I am a nurse, we have been taught in our educational programs and in our practice that we are committed to the service of others. I wholeheartedly agree. Unfortunately, a byproduct of that is that we may not care for ourselves as best as we can because we see others as more of a priority. So self-care really should be deceptively simple, but because of our lives, our professions, it's really not. It's often the first thing to go from our to-do list. But I really want to encourage you to self-care. I want to encourage you to change if you don't already think about it this way, I want you to reframe your thoughts about self-care, really think about how it can revolutionize your life, you personally, and also benefit those that you interact with regularly. And so I am a self-care practitioner, I am a self-care ambassador, and if you take away nothing else from this video during Nurses Week, I want you to take away the importance of you having a regular self-care, sort of making it a lifestyle practice. So what does self-care look like? So we think about holistic care, mind, body, spirit. Self-care really is essentially the same. I look at it in 4 domains. It's nourishing your body, nourishing your mind, nourishing your relationships, nourishing your spirit. We need all of those things. Some things speak to others more. That's why I think it's important for you to think about self-care as highly individualized. Some may find that they feel most charged or recharged after an intense physical workout. Some, such as myself, feel more recharged after journaling or meditation. The key is to identify what speaks most to you and do that. Even if it's just, here's the thing, even if it's just 5 minutes of each day. Now, I'd love if you incorporate it more than 5 minutes, but if you say, you know what, 5 minutes is all I've got to give to this, my friend, there is such an impact that happens when you self-care, even if it's just for 5 minutes a day. So, well, that's kind of what self-care is, and I could go more in depth, but for the sake of time, I won't. Self-care is not. There are so many myths about self-care. One of the biggest that I think I hear is that self-care is selfish. Self-care is not selfish. In fact, self-care is selfless, and it's sort of a frustrating misconception because I think that when you make the decision, when you take the courage to actually care for your own health and well-being, then not only are you personally benefiting from that, but you're empowering others to do the same. You're saying, I value and acknowledge that my care is essential to my interaction with you. And so by self-caring, you unconsciously sort of give people permission to do the same. I like to refer to this scripture in the Bible that says, love your neighbor as you love yourself. And even if you're not a religious person, if you think about that, if you're able to love your patient and love your family members and you're not displaying that love and care to yourself, how much more deeply connected could those relationships be, even with your patients, if you decided, you know what, at minimum, I'm going to self-care for 5 minutes a day. So self-care is not selfish. In my opinion, it is selfless. Another concept or myth of self-care is that it's one size fits all. It's not. As I said, it's highly individualized. Do what works best for you. Most importantly is that you have a self-care regimen, or that self-care is a lifestyle practice for you. So do me a favor. Can you take some time during Nurses Week to sit and think about where self-care is in your life and how you can be more intentional about your self-care if you're not already. If you are intentional about your self-care, can you do me a favor? Can you help someone else, even if it's just one nurse colleague? Can you help them to do the same? I want to thank you all for the work that you're doing in terms of the health of our nation, particularly during this pandemic. If there are any resources that I can extend to you in terms of self-care, I'm happy to do so. Please look me up on the web. But as I said, if you don't take away anything from my message today, please take away my encouraging you, if you don't already, to self-care. If you do, do it more. I want to offer this to you in closing. I think that the power of the breath is such an amazing way that you can honor yourself as an individual. If all you have is 5 minutes, take those 5 minutes, quiet your thoughts, and focus on your breath. Deep breathe for 5 minutes, set your timer, and focus on your inhale and your exhale. And what you have just done, my friends, if you decide to do this in 5 minutes, is honor yourself, is self-care in the highest way possible by giving your body the power of breath. Again, thank you for all that you're doing during these tumultuous times, and best of luck to you on your self-care journey. I'm so hopeful that this will, if not already, revolutionize the way you begin to think about and do self-care.